All right, it's 12:30, so we'll kick off. Welcome everybody. Welcome to this Lunch and Learn webinar on childhood milestones and getting the most out of your childhood vaccination appointments. My name's Kira Wright and I'm the immunisation team leader here at SESLHD. From SESLHD, we also have Fleur Niven joining us, Practice Support Officer, and Karen Wheeler, the Strengthening Care and for Children Program Officer. And then from the Southeast Sydney LHD, we have Nora Crotty, Nursing Unit Manager for Child and Family Health Service. So welcome everybody. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community and pay respect to elders past, present and emerging. Sovereignty has never been ceded. It always was, always will be Aboriginal land. I also extend that respect to Aboriginal colleagues who may be joining us today. I would also like to acknowledge people with lived experience of disability along with their carers and those that support the sector. A bit of housekeeping. This webinar has been recorded and will be available on our YouTube channel within the next couple of days. So please ensure that you submit your questions to the speakers via the Q&A function throughout your presentation. To view this box, you can hover over the toolbar at the bottom of your screen. We will monitor the Q&A as we go, but we might just keep the Q&A to the end, but definitely ask your questions as they come to mind. We also have the evaluation form that will be available at the end of the presentation. So please click through to that and fill out the evaluation as it helps us with our presentations. Just a bit of an FYI, we have the Healthy Aging Hubs. The Sutherland Shire one is now open. So if you'd like more information, please visit our website. And just some upcoming events. Tuesday, the 4th of April, this one's at night time, is the immunisation update for 2023. So that starts at 7 p.m. So if you haven't already registered, please jump on our website to register. All right, I will stop sharing now and I would like to introduce Nora Crotty. She's the Nursing Unit Manager for Child and Family Health Services at Southeastern Sydney LHD. And
hi, sorry, I'm just going to share my screen.
Thank you.
There we go.
Perfect. We can see your screen perfectly.
Lovely. Thank you. Okay,
Thanks,
thank
Nora.
you. Thank you. Hi, everyone. I am, as Kira said, I'm Nora Crotty. I'm the Nurse Unit Manager from Child and Family Health in the northern sector of the Southeast Sydney Local Health District. I've been working in, just to give you a little bit of an idea about myself, I've been working in early childhood, child and family health since the early 2000s. I'm a registered nurse, a registered midwife. I've got a postgrad qualification in child and family health. I'm a certified lactation consultant and I'm just completing my master's in medical and health leadership. So thank you for joining today. I would also like to acknowledge the traditional owners of the land that we are meeting on today and pay my respects and recognise their unique cultures and customs and honour the elders past, present and emerging. So for today, the learning outcomes that I have been given were that you would be able to demonstrate an understanding of the importance of milestone surveillance at appropriate ages, develop an understanding of how to complete the milestone checks in conjunction with the immunisation checks, and also just to hopefully improve your knowledge about the child and family health support services and resources that are available in both Southeast Sydney Local Health District and within the Sydney Local Health District. And in fact, all local health districts have child and family health services. Some service delivery models might vary, but essentially we provide the same services to everyone. And I believe that Kira has a couple of polls that she's going to drop in at some stage to just see what your knowledge is. So what I'm going to take you through today is just about our service, the Blue Book and the developmental screenings, the two tools, the Learn the Signs Act Early, that's in the Blue Book, and the Ages and Stages questionnaire, which we use in our service. Just a brief overview, first of all, about child development, and it's something that I'm sure you are all very well aware of, but these are some of the factors that influence a child's development. We've got the intrinsic factors, which start preconception, during pregnancy. Their genetics is what the child is born with, their temperament, their personality. Any preconception or antenatal factors such as maternal nutrition, maternal smoking, alcohol, substance misuse, and essentially those are for the preconception stuff relates to both parents. Any stress, any mental health issues, any anxiety or depression that the birth mother may be experiencing during the pregnancy. And then afterwards, we've got the things like the attachment between the primary caregiver and the child. We've got their access to adequate nutrition, to shelter, the effects of homelessness or poverty on families. We're looking at the child's exposure to early learning activities and environments, their exposure or their engagement in preschool before they start school. And we're also looking at, and I suppose all of those talk to the adverse childhood experiences that children can experience as they are growing up. This is a slide from the 70/30 campaign in the UK. It looks at the adverse childhood experiences. So all of these domains, the household challenges, domestic violence, substance abuse, parental separation, emotional, physical abuse that they may experience, sexual abuse, or any emotional or physical neglect. This came out of the Kaiser studies that were done through the CDC in the United States. And what they looked at was the cumulative effect of these adverse experiences. And the more of these adverse experiences that children are exposed to, the greater the impact that it will have on their childhood and extending into later life. So it increases the risks of lung disease, adult smoking, mental health issues, engagement in risky behaviors, liver disease. So the impact is lifelong, and the impact is across health services. So what we need to be able to do is try to intervene as early as we can and put supports in place where children might be experiencing any of these vulnerabilities. Some recent data on early childhood development came from the AEDC National Report from 2021. And that was on data that was collected between May and July 2021. And that was during the COVID-19 pandemic. 305,000 children were screened. 7,500 schools participated in the study. And what it gave us was an insight into the early effects of the COVID-19 pandemic on children and their families. So you'll remember that there was nationally lockdowns, schools weren't open, there was limited access to healthcare services, families were isolated essentially, there was an increase in domestic violence and mental health issues, which have all been reported. And what it showed that was on a national level, the percentage of children who were on track in all domains when they started school decreased for the first time since 2009. So in 2018, 55.4, that was the previous result, 55.4% of children were on track across all 5 domains when they started school. And this reduced down to 54.8% in 2021. Now, children who are assessed as being developmentally vulnerable in 1 or more domains increased from 21.7 to 22%. And in 2 or more domains increased to 11.4% from 11%. So we can see now that there's a trend that development has been impacted by these things. And what we want to try and do is stem this change. So with, sorry.
I've just launched the poll there to just complete while you're talking. Sorry, I've just launched the poll there to complete while you're going through the first slides.
Shall I continue? Or
yeah, keep talking, and then we can publish the results when we've got enough people.
Okay. So what we are looking at, and the strategy that underpins our work at the moment, is the first 2000 days framework, which was published by New South Wales Health in 2019. And it's essentially a strategy outlining the importance of the period from conception to 5 years, and what we need to do to ensure that all children have the best possible start in life. And the beauty of the first 2000 days framework is that it doesn't just talk to our child and family health nursing services or to GPs or pediatricians. It talks to all health professionals, including adult services, because of the impact that adult illnesses and adult mental health issues can have on children, and then the consequential impact on their life as a whole. So that's what we're looking at today. Just to give you a bit of idea about the services that our Child and Family Health Nurse Service offers, and like I said, this is similar in Sydney Local Health District, and it's also across local health districts across the state.
I've just shared the results there too of the first 2 questions to get an idea of where people are coming from.
Okay. All right. So we do have a little bit of education to do about our role and how we can help support you when you see families, if you would like us to do that. So we provide services. We do child health screening and surveillances. Look, I think there's a very traditional view of child and family health nursing in that we weigh babies. And that's certainly what a lot of people think. And that's certainly how we started out. We were looking at the physical growth and well-being of children, particularly in the early 20th century when infant mortality rates were high. But over the last 20 years, there's been a significant change in our nursing speciality. And we're looking at all the other effects. We're doing psychosocial screening, domestic violence screening. We're looking at all the other factors that go into nurturing a child and supporting the attachment with the primary caregiver. So we're looking at the whole family structure. We try to work in partnership with families. We identify what strengths they have, and we work together to put in supports for any vulnerabilities that they might be experiencing. So child development, child health screening, nutrition and feeding support, health promotion and education, infant and perinatal mental health screening and support, and just ensuring the safety and welfare and well-being of the children and their carers. And we provide those services. We do home visits that can be mainly for the 1 to 4 week checks for families that are identified with vulnerabilities. So the Safe Start, New South Wales Health Safe Start policy supporting families early, it allocates a level of care 1, 2, or 3 based on vulnerabilities that families might have. So families that might have level 2 or 3 vulnerabilities, we would offer a home visit to them for the 1 to 4 week check in order to increase engagement with them and really provide support for them. Families have follow-up in the clinics. We provide feeding support in the clinics or in the home. New parent groups we run for first-time parents. That is to provide or to create peer support for families within the community. Sleep and settling support, because that is an area that families really can struggle with, particularly if their children aren't settled, they don't have much social support. Sustained home visiting programs. In the southern end of our area, we've got the Sustaining New South Wales Families program, which is a 2-year extended home visiting program where families are engaged, hopefully in the antenatal period, and then they can sustain home engagement for 2 years. The Sydney Local Health District has a similar program called the MESH program. And back in SESLHD again, for both St. George, Sutherland and the eastern suburbs, we've got parent support teams who provide shorter term home visiting to families who don't meet the criteria to engage with sustained home visiting programs, but who still need some additional support in their homes and with raising their getting their children started. These are just the locations for the Sydney Local Health District, but we have got links in the resources for the services that are available in the Sydney Local Health District, and also more sort of where to go if you wanted statewide information. And this again, we've got platforms on social media as well, where we provide health promotion information and advice to families. So just a summary again in one slide, that is what we provide when we see families. We're looking at everything that goes towards a healthy lifestyle. We've got the infant and perinatal mental health support. We do the psychosocial screening. We complete the Edinburgh postnatal depression scales at regular intervals. We screen for domestic violence. We've got this child protection role where we report any risk of significant harm, domestic violence routine screening on all families. We are, of course, mandatory reporters as health professionals. So have we any concerns? Sorry, I've just taken the hand off my mouse. We are mandatory reporters, so we are obliged, if we identify any concerns, to notify Child Support Services, Department of Community and Justice, in order to get supports in for that family. And these are who we can refer to, and we do a lot. We refer to yourselves as GPs. We can refer to some allied health services, mainly physiotherapy, but we do require support from the family's general practitioner in order to get a referral to other allied health professionals, counselling support, drug and alcohol services, and some community paediatric clinics. But mainly our main source of referral is back to yourselves. So what I just thought that I would look at first is
sorry, Nora, just to interrupt there. I've just launched the second poll to get an idea of when people do refer for the milestone check. So I will launch those results when we get a few more questions answered. We're at 50% of people answering the question. So if you'd like to complete the short poll, and then we can share those answers as well. So when a parent books in for a child vaccination, is a developmental milestone check routinely performed? Yes, the GP completes. Yes, the nurse and GP complete, or then just the nurse completes. No, only immunisations are done, or no, only immunisations are done, but the parent is told to book in with the child and family health nurse, or other, if you have something else that you do, and you can share that with us as well. So I'll just leave that open for a few more seconds. All right, so let's share those results now.
Oh, that's really good.
Yep.
68% are with the GP and the nurse completing them. Yep,
excellent. So you're doing great out there. And I guess this education session is to just let you all know a little bit more about, when you can refer on, or if you'd like to, do it in-house, what kind of is covered. So Nora, I'll hand back to you.
Okay, so I was going to talk about why you would do a developmental check with vaccination, but it would appear that I am speaking to the converted. But anyway, I'll quickly run through it, and I can run through what we can do to support you with that. So probably, as you've all identified, it's opportunistic. The family's already there. The incidence of families attending child and family health drops off at 12 months and with subsequent children. So it's generally then to yourselves that the family will come in order to, if they've got any, to see for the immunization. So therefore, we see that opportunistic part of that. It's an early intervention. It's an early intervention opportunity. Free allied health support's only available up until around school age, and then it becomes the domain of education and access to private services. Sorry, I thought I had turned that off. There we go. The AEC data, as we saw earlier, it shows that we need to take every opportunity that we can to look at children and check where they are developmentally. What we might be able to do for you is that we can assist you in having more information available to you when you are going to refer on to the pediatrician or to some allied health services. We can provide information from the secondary screening tools that we have. So the ASQs or the ASQ social and emotional, which I'll speak to in a little while. And you can use this information to direct your referral rather than maybe as a first instance going to a pediatrician for a developmental screen when it might not have been necessary from the outset. So just very quickly, the Blue Book, which I would say are all familiar with from the number of people who are doing the immunization checks. The Blue Book, every child who's born within New South Wales is entitled to a Blue Book. If they've been born outside of New South Wales and are now living in New South Wales, they can get a Blue Book from this website here, and it's free of charge. The Blue Book, the hard copy that they get at birth is only available in English, but there are versions available in 18 other languages online. So if they show up without their Blue Book, which they often do, certainly to us, you can, if it's available in the language that they speak, use the digital, the online version to complete the milestone checks. As you have all identified, because you're doing the majority are doing the immunization or the developmental check with it, the core visits as per New South Wales Health are all aligned with the immunization schedule. And just very quickly to go through the Blue Book, if somebody's not very familiar with it, all of the checks have the same sort of layout. They've all got a sort of age-appropriate safety information for the 1 to 4 week check. It's the safe sleeping. They've all got sort of developmental concerns, what I should be doing, what am I doing? It's got questions for the parents if there's anything that they are concerned about with their baby. Then it's got feeding information. This is the check that you fill out. In here again, you can see that there is any risk factors that this relates to the family. So is there any history of hearing or vision problems, any oral health issues? Because we know that parental oral health and early childhood issues in parental oral health will affect children's oral health. And again, then we've got the anticipatory guidance. We've got the health promotion that we would be providing with them and the specific stuff that relates to the age that they are coming to see you with. So as GPs, obviously your time is very valuable, very short with the family, but these are some things that, you know, with your practice nurse or you can have as resources within your clinic to provide some information to the families. You can always be saying to your admin staff when you're booking the check that, you know, remind the families to fill in those sections before they come and see us so that we don't have to wait while we're doing it or go through it. We can see straight up what we need to chat with. Child development, and this is where I'm getting into how we can really help you to have these discussions and to appropriately refer, looking again at the 4 domains of child development, so social, emotional, language, communication, cognitive, and gross motor development. The Learn the Signs Act Early has checklists for all ages up to the age of 5. This is one for the 12 months check. The Learn the Signs Act Early is from the CDC in the United States. Its website has a lot of resources for families to use, but also for health professionals to use in their discussions with their families. The developmental surveillance that we want to be doing with families, it's longitudinal, it's continuous, it's a cumulative process that helps us identify children with concerns. And Learn the Signs Act Early, in the blue books currently, and that's probably what you're familiar with, there will be this section called red flags, which is that section there. Now that's gone out of the blue books. Oh no, it's not gone out of the blue books. It's gone out of the checklists on the CDC website, and it will shortly go out of the blue books as well, because there was a major review of the checklists done. And what they realized were that really 70 to 80% of children should have been doing or were doing what was in the red flag area. So what they've done is they've incorporated the red flags into the checklist. And now if a child isn't doing something that is in the checklists, these updated checklists that are on the CDC website, then it is a trigger for secondary screening or further evaluation of exactly what they would do. Now, when we see a family, and if they were to tick anything in there that the child wasn't doing, what it means is that we need to sort of have a look and see if the child has had any exposure to that. So you might find that you've got a child whose gross motor skills, you know, they mightn't be pulling to stand, they mightn't be cruising around furniture at 12 months, but has that child had the exposure to learn that skill? A lot of time families are busy, especially if there's older children in them. They want to keep the youngest one happy. So you get people using walkers, or you get people using those jolly jumpers where the child is not on the floor. They haven't had the exposure to develop a skill. So what we'll do is we'll have a chat with the parent, see if they've had that exposure. Maybe give them one of these resources, which is on the CDC website, so that they can look at what they can actually do with their child to help them develop that skill, and then bring them back if it's a thing that the child hasn't had exposure. If they've had exposure and they aren't meeting those skills, then obviously we would act a little bit more assertively in the follow-up that we would do with them, or that you would do with them. And that is what I'm going to talk about in a minute. Just to show you very briefly, these are some of the resources that are available from the CDC website for families to track their own child's development. And these are some resources that are on the New South Wales Health website. So resources for parents around their child development, but also some resources for yourselves on how to incorporate it and into the immunization checks if you're not already doing it. And how to talk about child development with the family. Now, I've just got a very short case study to go through with you. This is the secondary screening tool that we use. This is an ages and stages questionnaire. It's a 12-month questionnaire. You can see that there's an age range that it is used for. There's about, I think it is 36 of these questionnaires for the age range between 0 to 5 years. And what it does is it looks at the different domains of development. And the parent does this with the child. They don't have to do it all in one sitting. They can do it in bits and pieces. But essentially, they're saying, yes, the child has the skill. Sometimes the child displays the skill, or they haven't got that skill just yet. It's a score of 10, a score of 5, and a score of 0. And then we total it up, and each total we transfer to a scoring sheet, which I will show you. Now, if you've got a child that has ticked some concerns on their milestone checklist, you can refer them to us if you would like to have a secondary screening and to get yourself some more information about what might be the best referral pathways to go, rather than doing a blanket to a pediatrician. So we will we'll do these screening tools with the child. We'll explore what the families say about it. And then I'm just going to scoot across very quickly. I want to show you, this is the scoring sheet. So essentially we will put in whatever total we get for the domain and see whether it falls above or below the cutoff, or whether it falls within I might need to keep an eye on this kind of range. And that's the information that we would send back to you as the GP to inform your referral for the child. Those again are just some other resources that you might like to have in your practice to help with, for yourself or your practice nurse, to have discussions with the families. Sorry, now I'm back and forth, but anyway. So why is early identification important? And I think that sometimes we can see a child once and we can identify a couple of things. Sometimes we, rather than sort of jumping straight into a diagnosis or this is where you need to go, we sometimes have to take it a little bit more slowly. And for some parents, they need that sort of more stepped approach in order to be ready to accept that maybe there's an issue with their child's development. And a stepped approach where you might identify something, you might send them to us, and the parent gets a chance to look at exactly what the child is doing and look at what their expectations of the child's development is as well. And then we refer back to you for to give you this information, and then we can assist the family to sort of look at the loss of expectations that they might have for that child's future, gives them a chance to consider what it might mean culturally for them, financially for them, for their family unit, for the family relationships, if there was to be a developmental delay diagnosis for their child. So just briefly before I finish, I'm just going to go through a case study and suggest two different pathways that might be appropriate for you to consider if you see a child. So in this case study, we've got 3-year-old little boy called Sam. Sam's got 3 older siblings at home. He's disruptive at daycare, it's reported. He doesn't like to play in the sand. He doesn't engage with other children easily. His speech is not easily understood by others. And his mum is saying that, you know, she's got some difficulty in setting boundaries. There's especially around sort of bedtime, toileting, lots of screen time is a big thing in the family. Sam's having a few tantrums. Both parents work full time. So they've come to you. Oh, sorry. There is another poll. So just based on those kind of things, what are you thinking you might do with Sam?
So yeah, where would you refer Sam first? To a PED for GDD diagnosis, to allied health, OT, family counselling, or a child family health nurse? All right, we've got 75% of participants have answered, so I'll end the poll there and share results.
Excellent. Okay, good. Almost 50% might refer to us, which is good. So to carry on with the 2 scenarios, and interesting that the 2 options that were chosen were the PED or the child and family health nurse. That is taken into consideration in the 2 trajectories that I'm suggesting. And I'm hopefully will also reflect why, based on that stepped approach to diagnosis that I spoke about just a minute ago. So with Sam, when he's come to you for his 3-year, when he's 3, this is what mum's ticked in the blue book. So the things that he's not doing that most children of his age would do is noticing other children and joining them. He's not saying these things. He's not talking well enough for other people to understand most of the time. His thinking, learning, thinking, and problem solving in these areas seem to be a little bit not so great. And he's not dressing himself doing those kind of things, which might be a reason why mum's saying she's having trouble putting in boundaries around toileting and things like that. So this is the first trajectory, and it's pretty much a medical pathway. So his mum's only come to you because the daycare has suggested that she does. You've tried to explore the issues with her, but she thinks Sam's fine. Sam is just normal. He's just a normal, energetic 3-year-old who has 3 older siblings at home. As we can see, she's done the Blue Book check, and you've rightly identified some developmental concerns, and you referred to a PED for outcome. And we're not suggesting this would be the outcome in all cases, but in this case, the pediatrician provides a diagnosis of ASD and ADHD. And what the mother does then is she disengages with the pediatrician. She tells him that, or she tells you that she doesn't like the pediatrician, and she actually doesn't believe what he says about Sam. And because she's disengaged, then it's unlikely that we will be able to re-engage her down a developmental path, at which point Sam will enter school with a developmental delay and a consequence put him at disadvantage with his education. Now, the second trajectory that we would be suggesting would be more of a multidisciplinary team pathway, in where mom hasn't, she doesn't really see the issue with Sam. The milestone check you've done showed the concerns that we had earlier. But in this case, what you've decided to do is you've referred to us for the secondary screening. And what sorry, I've gone the wrong way. What that screening has shown, we've done the ASQ, which is the Ages and Stages questionnaire, looks at the physical development, the fine motor skills, gross motor skills, problem-solving skills, personal, social, and emotional. So it really works down into what in those 4 areas that were in the Blue Book that you looked at, which areas really of concern were there for Sam. So in the black area, his fine motor skills were really needed some attention straight away. He was sitting on the cusp for his personal and social skills. His problem-solving skills, which you can remember from the cognitive milestones up here, he looked like he wasn't doing the 2 things in that checkstone. But when we do the Ages and Stages questionnaire, his problem-solving skills and the way the mom has answered them in the Ages and Stages questionnaire shows that he's not got a problem in that area. Communication, yes, he's in the sort of put some intervention in place and review score of that. So what we would be doing is giving you back this information so that you could then sort of look at it and see exactly where he needs to go. Because the personal and social was on the sort of borderline, we would probably do our other questionnaire as well, which is the social and emotional questionnaire, and see exactly where he sits with his sort of interpersonal kind of relationships. So here what we have done is been able to give you back the information from these 2 screening tools. We've given parents some activity sheets. We've given you feedback for ongoing care. You've been able to sort of generate sort of more appropriate targeted referrals for the areas of concern that he has. We would bring him back after 6 months and repeat them if it was needed. And in Sam's case, we have surmised that by the time he sees you for his immunizations and his 4-year check, the concerns that were highlighted have been resolved. Because what's happened is mum's had a sort of more graduated approach to having any sort of diagnosis made. And she's more willing to continue and be engaged with discussions around Sam's development. So this is just that sort of gradual early intervention approach. Something is happening while the family might be waiting to see a pediatrician for review if that's what needed to be done. So just briefly, some referral pathways for you. There's some health pathways that you have got available to you to make some, to sort of inform you around what information, what is available to you. So our referral pathway is through this central intake number. There's a priority line option for yourselves or any other health professionals who would like to make a referral of a family to us. Sydney Local Health District have this central intake number, and their service is called Child Health Information Link. So both of those are available to you for referral pathways. And this is an education resource which has been developed by the Sydney Local Health District for general practitioners in sort of how to looking at the Well Child Health Programme and developmental screening. So thank you very much. Sorry, I think I probably ran over a little bit, but thank you for listening. That's it.
Thank you, Nora.
Stop sharing.
Yeah, thank you. That was a great overview of what you guys can provide. And we do have a few questions as well. I might just jump into them now. First question is, do you have enough staff to meet the needs?
No, and that is why we would like to be working in partnership with GPs. We can, like I said, a lot of families disengage from us, and that's fine. We're not a compulsory service. We don't have enough staff to meet all the needs of everything, but we would absolutely be willing to try and meet the needs of the vulnerable families that need to see us. And if that means, you know, looking at alternative models of care and path, we are actually looking at there is a project underway at the moment, which I think I forgot to mention, where we're trying to work with specific GP practices in order to have a combined approach towards where we can make both the best use of everybody's expertise to get the best outcomes for families and to have referral pathways back and forth between our services.
Yep. So yeah, I think that was in the Southeastern Sydney Local Health District. So if you're a practice within the Southeastern Sydney LHD that would like to more information about this pilot study, get in touch with us and we can refer you on. So just use the immunisation@sesfen.com.au email address if you'd like to reach out and be part of the pilot program. Just on that as well, there was another question similar. What is the waiting time for your services and how do we refer?
So the referral is, at the moment, referral is through our central intake numbers that I just there on the last slide. The waiting time is usually only 1 to 2 weeks in order for our service up here in the north. We only book a week in advance. So usually we can accommodate an appointment a week later. We would see the family, give them the ASQs, or we might even, based on the information that we get from the general practitioner, send the ASQs, talk to the family over the phone, send them the ASQ questionnaires bring them back in and review that with the family. So not a long wait list, no.
Excellent. And just on the ASQ checks as well, we've got a question. Can we as non-New South Wales health employees have access to these child health learning resources, or do we have to register with HEDI, or is it open to use the ASQ sheets?
To use the ASQs, you actually have to buy the license for the ASQs to use them. So we in Child and Family Health use them. I'm not sure how you would go about they are licensed and you have to buy the license in order to use them, to the best of my knowledge.
Great. So I guess then in that scenario, the best thing to do is refer on to the Child and Family Health nurses to do those checks. Yeah.
Those ASQs actually take a while to do. So the family have to spend quite a bit of time completing them. Then we come back, you have to score them. They're 2 or 3 pages long. You score them, then you've got to go through the scoring, see where it fits in and see what it is involved. So they are time consuming screening tools.
Yeah. Okay, great. And do you as Child Family Health nurses upload the reports to My Health Record?
Not My Health Record, no. We would have to send the GP we would send them the completed questionnaire and the feedback from it to inform, but no, we don't upload to My Health Record. We don't at this stage provide discharge summaries either, because we don't technically discharge children. We're a screening service till the age of 5. So no, we don't do to either My Health Record or HealthyNet.
Yeah, okay, great. One question which might be a bit difficult to explain right now, but where we can go for further information if not. As a nurse, how do we do the hip and eye checks?
You need training, first of all.
Mm-hmm.
So there is the Royal Children's Hospital in Melbourne has a very good training module on hip dysplasia. That is what child and family health nurses use during their training. There is also practical training that you need to do. You need to have practice on a little mannequin, for which it allows you to perform both the maneuvers, the ortholani and the Barlow. What was the other one? Was it eyesight or hearing?
Yeah,
eyesight. So again, the 4-year check is the STEPS program. There's 2 modules for STEPS on My Health Learning. There's also, I would suggest if you're going to be doing the STEPS screening that you would have some time with an orthoptist as well in actually doing the screening. And then before you get to the 4-year checks and you're just doing the routine eye screening in the Blue Book, I think that training for that would be included in newborn screening training on My Health Learning as well. That's where we would get that. We also spend time with eye health professionals in learning how to do it properly.
Excellent, thank you. And you did mention some free allied health support earlier. Is this in the hospital clinics or are there free clinics available elsewhere?
No, it would be through. So in the South community, pediatric community allied health exists down in St. George Sutherland area. In the northern area, it is through Sydney Children's Hospital Community Health, Allied Health. And then I suppose if people weren't able to access that and they needed referral to be seen, I think then that would be GP referral pathways through private specialists, or I don't know, is some of it covered under Medicare if there's already a diagnosis with the child, if they've got 2 or other vulnerabilities. I think some allied health can be accessed through private providers if under Medicare, if they've got a couple of other diagnoses as well, or issues. Okay.
Maybe Fleur can help us answer that one too. And one of a similar train of thought, can you explain how the GPs can subsidise for children access to OT and speech pathology?
I don't think I can answer that one. I'm really sorry.
Okay. We'll take it on notice, Catherine, and we'll let everybody know if we can find out any more information about subsidised services for children. Okay, well, thank you so much, Nora, for all that information. We've had some feedback that it was a wonderful and very informative session. So that's excellent. I'm glad that everybody got something out of that so far. So Fleur now, Fleur is our practice support officer here at the PHN, and she's just going to do a quick overview on how we can tie in what we've learned about milestone checks and getting them involved with the childhood vaccination appointments, how you can assist your practice to do that within your practice software using the reminder system. So take it over, Fleur. Would you like me to share your slides, or you're doing it? Yep, you're doing great.
So just while I remember that question about getting support that's subsidised for OT or anything, the only thing I could think of at the moment would be that if the child under the age of 6.5, you can get NDIS support without a clear diagnosis of any disability. So if there's some learning difficulties or something, and you've got your assessments from Nora and her team, GP referral, then you should be able to at least start getting some support from NDIS, so the child's ready for going to school. It would be a paediatrician that you would go on to for further.
Okay, and someone else also mentioned the EPC program for GPs, so that's another way that you could.
Yeah. Still subsidised, but not bulk billing at the moment, I think. Yeah. Yep. So just quickly covering our milestone reminders and linking them with childhood vaccinations. So first of all, what is a reminder? So a reminder involves, as most of us know, notifying a patient that a recommended investigation or a procedure is due. Whilst there is no legal requirement to send or follow up on health prevention reminders, the practice team should also still record all attempts to contact the patient in health records for ongoing care. And remember, a reminder is not a recall. So we're just talking about reminders today. A recall is for clinically significant results and requires follow-up. That's a judgment made by the GP that something is clinically important for that patient in the context of their healthcare. So what do we use reminders? Continuity of care, patient engagement, preventative health, such as cervical screening, immunisations and health assessments, health promotion and nurse-led clinics. We've got the flu clinics coming up. And lastly, we cannot forget that general practices are a business with staff to pay, computer technology, purchases, and so on. So yes, practice viability is also important when looking at reminders and healthcare prevention. Most of the time, the GPs and the nurses are doing the work, they're just not billing for it. So here we have a review maybe of your reminder system. The diagram that you can see covers all the areas involved. So to ensure you understand your practices, procedures and systems, as every practice is unique in this regard. So who is involved and do they understand the part they play? You could create a reminder code in your software for milestone childhood vaccination visit. You could use your data extraction to identify children coming up for their childhood vaccination and adding in the milestone childhood vaccination reminder. Consider if you will use your SMS messaging or other online system to send out reminders, or will clinicians add the milestone vaccination reminder in the software opportunistically? Then is everyone at your practice using the clinical software to its full capacity? Consider, when did you last review your software systems for reminders? Software updates happen frequently. Best Practice and Medical Director have Vimeos and education resources. These are free and accessible to you, so you can contact them if you're in doubt or need an update. Then are you confident with the quality of the patient data in the health records to facilitate the search, extraction, and utilisation of the patient data? You may need to do a cleanup of free text reminders and consider turning off the ability to free text. Additionally, consideration to protecting the privacy and confidentiality of patient information. Patient consent is usually obtained when completing a new patient form, ensuring provision for opting out of reminders. You may have permission to send an SMS for an appointment, but do you have permission to send an SMS reminder for preventative healthcare initiatives? Consideration 2, the needs of patients with a physical or intellectual disability, ensuring fair access to your services. So how can we book milestones and childhood vaccinations? The practice reminder system includes all of the team. It's not a one-man job. It's not up to one person to keep it clean or tidy. How do you educate your parents and carers on the importance of milestone checks? Can you provide a checklist on your website saying what your practice does for children? For example, we provide milestone checks and complete your child's blue book during childhood vaccinations. It's important also to involve your reception team. How do they recognise that a parent or carer is booking in for a childhood vaccination? And what is appropriate for reception to ask? Could it be something like, please remember to bring your child's blue book along to the appointment? That is a good start. Next, booking the appropriate length of time. An example would be reception booking a patient in, say, for 15 minutes with the nurse and then 10 minutes with the GP. You could monitor how this works as part of your quality improvement activity. So when I spoke with Nora earlier, she said that it takes about 5 minutes, the majority of the time, to complete the learn the signs and act early. So maybe having a practice run before you work out the time, and also discuss it in your practice meeting about how you're going to start. Now, billing. For those who don't know, in the old days, completing a blue book and milestones was included by Medicare as a child health assessment. It had a health assessment item number. When it was removed, many GPs did not realise that a timed consult, such as an item 36 or item 44, should be billed. Unfortunately, many practices stopped this screening, and it has had a knock-on effect to childhood health and learning outcomes. If you have patients concerned with the price of consultations as well, please refer on to your child and family health nurse so they are not financially disadvantaged. Lastly, don't forget to consider your practice's follow-up systems. Here we've got some resources which will be sent out. They'll have links on them to their recalls and reminders webinar, practice support and digital health team if you would need some support on cleaning up your data, setting up some systems, etc., and all there. So that's it from me. And thank you very much, Nora. I learned a lot as a parent and hope I do a better job when I'm eventually a grandparent.
Good luck with you, Fleur.
Oh, yeah.
Thank you so much, Fleur. So I hope that gave you some practical insights into how to merge this training into your, daily systems within your practice. If there are no further questions, which there doesn't seem to be, I will wrap up the Lunch and Learn for today. So thank you again to all our speakers, Nora and Fleur, as well as everyone attending this Lunch and Learn webinar. A reminder again to complete the online survey that will pop up in your browser when this session is finished, and you'll be sent a follow-up email with a resource sheet with some ideas for further learning, as well as some CPD point ideas, a possible QI activity you can do to help with this milestone check activity, and as well as some information on the early years shared care pilot program. So we look forward to seeing you at our next webinar. Thanks again. Have a good day.